Good evening. I'm Ellen. I'm the executive director of the First Hill Improvement Association, and we are a neighborhood group doing work to create a welcoming, vibrant, and safe neighborhood for everyone. And our work includes connecting, communicating, and convening like we are here tonight. We're honored to be partnering with Town Hall to bring this event to you, and grateful for our speakers to take time tonight to talk. So to introduce the discussion, in our conversations with those who live, work, and visit the First Hill neighborhood, one topic consistently rises to the top, and that is the overlapping crises that we are experiencing in First Hill and beyond. And some people frame these issues of homelessness, mental health issues, and addiction in terms of public safety, and others term them as public health issues. So really, it's both. So as we're talking tonight, we're going to talk in interconnected terms about these issues that are complex and multi-layered for sure. But our goal tonight is to better understand how our system is responding to these crises, where the challenges lie, and what solutions are being advanced. So to do that, we've convened this panel of public officials, each who represent a point along the continuum of response. So Amy, as the chief of the care department, she oversees 911 and dispatches first responders. And these are often preliminary points of contact when someone's having a crisis and they come to the attention of the system. And then we have Natalie, who is leads coordination efforts across multiple departments, including the Seattle Police Department and the Care Department, and is shaping strategy around how the city of Seattle responds to urgent and ongoing safety concerns. And lastly, Leesa, who, as our King County prosecuting attorney, addresses the legal and accountability aspects of public safety, particularly as they intersect with behavioral health and system reform. So welcome, all of you, little slices of the system. Let's begin the conversation by trying to understand where we are. So drug crises are not new, nor is a lack of access to mental health care. In Seattle, the lack of affordable housing isn't all that new either. So what's different about where we are right now and why these crises are so visible and challenging? Amy, do you want to start?
Yeah, good evening, everyone. So it's true, these are not new crises. Most of my career, I was working in mental health, especially for kids, child welfare. And I have spoken for years about our divestment in institutional mental health in the 60s, that we knew asylums were bad. There was often abuse, and they were ineffective, and so we closed them, and politicians made a plan, a proposal that we should have community-based resources, and we never invested in those in any kind of meaningful way in any community I'm aware of. And so we have, at this point, we're 50, 60 years later, a lot of neglect. When I think about first response, I think about the 911 calls for service. And if you go back and look at data, by the 60s, it was evident that about half the calls were really social work calls. Think about PTSD in the space of Vietnam, escalating rates of addiction. You have domestic violence, things like that. But we never set up a response to it. We didn't set up the new first responder. And then, again, we did not invest in a system that was rehabilitative. We really focused on, I think, more jails and prisons, relied more heavily on law enforcement to address problems of human suffering. And so I think at this point, it's just proliferated and perpetuated, and it's an enormous problem now. And then you couple it with drugs like fentanyl, which are unprecedented. We've never seen anything like that. These are lethal drugs. And so I think that's why it's so much worse today.
I would agree. I agree with everything that Amy just shared. I think what I would add to it is that we are coming off of a worldwide pandemic where the entire world felt different and looked different. And the things we saw playing out on the street during the pandemic were very much like right here and present. And there were reasons for that. I mean, we had to restrict bookings at the King County Jail to keep individuals who were incarcerated safe, but also our corrections officers who were demanding that we not overfill our jails during a worldwide pandemic. Also, lots of laws get changed within our community, and sometimes there's very little focus on what happens. But we had a change in the law where the Blake decision, our Washington State Supreme Court ruled that possession of small amounts of drugs was unconstitutional. And it very much grabbed the attention of our community, of law enforcement, of court system. And then there was a debate here in city of Seattle about, not just city of Seattle, but statewide, about what to do post-Blake to ensure that there was both accountability but also access to treatment. And sometimes those things are in tension with one another when, in an ideal world, they work in collaboration. So those things played out in very real, visible ways in our community.
I think just to add to some of the things that have already been said by my amazing panelists, I think first of all, just highlighting fentanyl. We've had different iterations of certain drugs throughout the last several decades, and each of them have taken a toll in terms of the community. But fentanyl in particular has been realistically something that we have not seen before. I think first of all, it is cheap, it is easily accessible, and it changes people, it changes their brain chemistry, and I think we are seeing people that are in the most need. And all of that does intersect with our public health response, with our public safety response, because when people are desperate to obtain a drug that they feel that they need to, and actually their body is telling them that they need, it causes them to engage in behavior that they wouldn't ordinarily do. So the approach to all of this has to be holistic. It has to be a public health response. It has to be a public safety response. And it also has to be an investment in the resources that we've already talked about here. And the biggest thing that I think we really need to focus on is the coordination of all of those efforts. And realistically, you're looking at a panel right now of panelists who do coordinate and are interested in making sure that we are not working in silos, that we are working together, and that we have not just a one-size-fits-all solution, but we need to be planning for the actual person in terms of that. And I think that's the key piece as well.
Okay, thank you. Can you, just in terms of crime and accountability, can you each share a little bit about your philosophy and approach, so the why and when of arrests and bookings and incarceration?
Sure, I will start on this. I know that we've had some previous conversations, and one of the things I get asked about a lot is whether arrest or booking into jail serves as a deterrent to crime. And from where I stand, I don't believe that it is a deterrent. I think most of the individuals who find themselves facing incarceration, one, never believe that they're going to be incarcerated or don't think that they're going to get caught, or they're so heavy into the throes of a crisis that they aren't thinking about the next steps. I do think that arrest and booking can serve as a really important intervention and an interruption to behavior. I think it's a point where we can start to take that holistic approach that Natalie talked about, but we have to, one, be coordinated in our response. We have to be really clear on what our goals are, and we also have to make the investments necessary to change the behavior in the ways that we want.
Yeah, I'm smiling because I just argued with my husband about whether or not bookings are a deterrent. So thank you for that. The reason I agree with that is because in the mind of the person, again, if I have a dependency on a drug, I believe the first arrest that we made after the open use ordinance passed, the person was holding a flyer that basically advertised, as of this date, you can be arrested. So it was sad. It was kind of funny, but dark and sad. I just don't think it's a meaningful deterrent. However, I do think if we use that opportunity, if you've interrupted a cycle that's destructive and self-destructive, if then you could help the person, right? If we had detox on the front end of jails and prisons and comprehensive, Leesa and I have talked about this, if that reentry planning was sincere and comprehensive and started from the jump, then you might see a difference. But I think the idea that the timeout fundamentally is going to change, especially a decades-long pattern, I just don't see evidence that that's true.
I think to add to it, it's really complicated and nuanced, but essentially a jail booking, and if we're just talking about that specifically, I wouldn't say a deterrent, it acts as an interruption. And that interruption can take many different forms. I think, again, just emphasizing some of the things that were already said is How much do we actually invest in jail release planning? If somebody is booked for 3 days, do they have the opportunity to have a full assessment of what they need? Do they actually have release planning? And jail health does do release planning, but do they do it for the mass of people that are actually booked? When we have a plan for anything and we communicate that plan well and there are steps in place for that, usually any person would do better than just our kind of recurring door-to-door that happens. I think jail bookings is just one piece of that. The key piece, if we're having jail, our courts, or any of that be part of the resource, is what is that holistic? We talk about accountability, and accountability is really important. I use accountability and responsibility for the behavior interchangeably. But the other piece to think about too is how are we utilizing our current criminal legal system? Do we have a holistic model? I've had the great fortune to be part of expansion of mental health court in King County, Veterans Court, where we are actually addressing some of the underlying mental health challenges that had been unaddressed, either based on diagnosis, based on medication, but also not having a framework in which to really be able to provide those immediate access to services. If we're looking again at a model that includes jail and the courts, drug court is another one where they are looking at the whole person from start to finish. What do they need in order to succeed? And when we've looked at those programs, both mental health court and drug court, you will look at the recidivism data and see that because there is a plan, it is much more effective and holistic. Even going to our prisons who have our prison drug offender sentencing alternative plan or a residential DOSA plan, those are a drug offender sentencing alternative as well. Those are programs that, again, look at the whole person and to say, what do we need to actually help get this person out of this cycle? And so if we're not looking at the whole person, if we're not looking at what actually is the underlying issues in terms of why people are criminal legally involved, it won't work. And so it is not as simply put as just looking at jail bookings on the whole. What is the key piece of that? So it is definitely more nuanced than just a jail booking. But it is an interruption that could serve a purpose if we fund that correctly, invest in that correctly, and that we also pair that with community-based services that are ready to receive that individual once they are out of jail or out of prison.
Thank you. So aside from the King County Drug Court, there are some other upstream programs that can help address substance abuse disorders and mental health issues to help improve public safety. So one of those is CARE. Amy, can you tell us a little bit about how CARE operates?
Yeah, so the CARE department has 3 divisions. The biggest is Seattle 911. The second, the one that's I think the public is most well aware of, are the community crisis responders. I'm always stressing that these are first responders. That is the design. From 911, I should be able to send someone instead of law enforcement and instead of the fire department when appropriate. But they're not meant to be case managers. They're meant to go out like police or fire to triage and then to hand off to the appropriate system. So we've been to about 4,200 calls at this point. We piloted downtown initially. No incident, really. Most of the time, what we're doing is getting somebody to where they need to go. So sometimes connecting people to services. Sometimes people want detox. We take folks to connections. About 10% of the time, we're referring to the Crisis Solutions Center. This is a vital piece of the puzzle. There's Judge McHale, who presides over drug court, has said several times, CARE, that diversion first responder, that is the missing piece of the puzzle. Because if you're trying to divert away from the criminal justice system, you shouldn't be using police, right, to divert. That's a contradiction. However, no matter how many first responders I have and no matter how good they are, police can be staffed up. I can have all the firefighters in the world and EMS and CARE. And if we don't have the appropriate system to receive the person and address the issue, I do not believe the city is going to look different. So I'm proud of the work that we're doing, but I'm very quick to say, and then what? What's next?
And if it's a voluntary system, what if people who are substance abuse folks whose brains are dramatically affected and really are not interested in opting in?
Right.
How effective is it?
Right. I think an ideal design, especially in the case if we think that somebody's using fentanyl, we think that their days are likely numbered. If we can see that in the data, sometimes I know we've already reversed overdose a number of times. My preference would be to be able to deploy care first, ideally to also have someone with lived experience, perhaps a peer on the scene. And then if that diversion strategy isn't effective, you can use motivational interviewing tools like that to try to incent someone into services to address their fears and their issues. Buprenorphine, especially this injectable form, is really hopeful. And I find that folks on the street are hearing about it, that there might be a path into recovery that does not involve these horrible withdrawals. But if that doesn't work, I think it would be appropriate then to call in SPD. And again, it's a designated crisis responder is the person who can refer involuntarily, can use Ricky's Law. And so I talk about this a lot. I think ethically it's so complex. The civil liberties conversation is so crucial. But I think we've been very intellectually lazy to just go, no, autonomy, civil liberties, good luck. And we had my first year on the job, we lost 1,400 neighbors to overdose. About half of them were under the age of 45. That is not okay. We can do better than that.
And how about LEAD? Natalie, do you want to talk to us a little bit about that program?
Sure. I'll just share that I started with LEAD when I was working back at the King County Prosecutor's Office in 2014. And so I think LEAD started in 2011. LEAD has changed and morphed over time. Initially, the LEAD program was trying to engage those that were engaged in public use, low level, and also lower level or substance use drug dealing or drug trafficking. It's evolved to address a number of different challenges, but the LEAD program's goal is to, again, be a diversionary model for both police and also for the community to provide referrals of those individuals they know that are in need. They do that through, again, a harm reduction model, and in addition to that, they have outreach services, caseworkers. They work with our communities. They work with other community providers. And they also work with law enforcement to be someone to be able to do a warm handoff to in terms of that. I think even LEAD has been challenged by the current fentanyl crisis and also, again, the need to invest and have on-demand resources. So there's a lot of people to help, and I think LEAD's doing the best it can with its current capacity. And we're also trying to understand, what is the best model for every one person. But LEAD is also something that the city contracts with in terms of a program. It's actually under the public safety lens at this point, and eventually we'll be working on transferring I think the LEAD operational piece to care, because we want to have more community providers for care to divert to. We need to build out that system. The mayor, we're sitting here right now, he would say that not every response needs a badge and gun or fire, and we definitely want to build out another system to be able to refer people to services as a first step. We still need our police department and our fire department, but we definitely need to continue to build and expand our current third public safety department in terms of care and make sure that they have the resources that are needed for that.
One thing I would add to what Amy and Natalie have said, and it's relating to LEAD. So there are currently just over 1,500 LEAD participants. So those are 1,500 individuals that are getting services every day. I think the model that Natalie spoke to and the hard work ahead of us is being very specific about what a LEAD participant needs. There are a category of individuals who really just need help with housing placement and case management. There are others who are really in the very heavy throes of addiction and have criminal legal involvement. And then there are the individuals who are there because of maybe behavioral issues or co-occurring disorders. And how we treat those populations are not the same. And I think, doing the important work of always being more clear in what kind of services are needed, how those services are differentiated, how those services are delivered in the holistic manner that Amy and Natalie both speak to, it's ongoing work. It's not a one-size-fits-all model, and it's not a one-and-done model.
The city auditor's report from last summer acknowledged that we lack a system of coordinating departments, programs, and agencies focused on overdose and crime prevention. So I think we've touched on it a bit, but what's the status of this overall, and what efforts have been made to coordinate and really employ a problem-solving strategy?
I can speak to, one effort among many in terms of coordination, and I think that's key. It's not just coordination around city departments or city contracted community providers. It's coordination between the city and the county, our state resources. And so I think one thing that the auditor's report highlighted is just the need for coordination at a local level, at a national level, and making sure that we're utilizing all the resources that are necessary. So I'll just give, in the interest of time, one example of that. One example that the city is involved in right now that includes SPD and CARE as some of our partners is the downtown activation team. In end of October of this last year, we officially launched the downtown activation team pilot, and essentially it was a led effort by both the mayor's office and SPD in terms of trying to address, first of all, the visual disorder that was downtown. It does include enforcement efforts. It also includes a holistic approach, so coordinating essentially our city contracted providers such as Reach and Lead and We Deliver Care. And then it also championed our Office of Economic Development and some of our private partnerships with the Downtown Seattle Association to say, how can we partner to address these areas as well? So in terms of coordination, we looked at 3 different locations. I think 3rd, Pike and Pine, Little Saigon in the CID neighborhood, and we're looking currently at 3rd Avenue into Pioneer Square. These are 3 of the 10 areas that the city auditor noted were places within the city that had a huge intersection of overdoses and also where crime is concentrated. So in that, Mayor Harrell championed in his executive order the need to address those areas. First, the visual disorder with cleaning in the area and the ability for city departments to do their routine maintenance. The second piece of that, again, is coordinating our holistic partners in terms of where they are in the city, what their resources are, the capacity, and making sure that we have presence and activation in that area. And the third is the economic recovery of downtown. Once we have a handle on those areas, ensuring that we are bringing back short-term and long-term activations, pro-social activities, things that draw crowds in to be able to walk that area, and hopefully also bring back businesses as well. Because when we know that when we have those businesses and foot traffic, crime does go down. And so I think it's one example of how we're trying to coordinate both city departments, our holistic response, and also our private-public partnerships with Downtown Seattle Association and the Mid-Ambassadors being a partner.
You know, one thing I would add to that is just the enforcement piece of it. So the coordination doesn't just end with like public health and public safety. Since I took office, I have struck up a partnership with the Seattle City Attorney's Office. And while Ann Davison isn't here, I will say that the collaboration between our offices has never been stronger. And same, our coordination with SPD. There are areas where we have had to address the open air drug markets. Drug dealing is a crime, it is a felony crime, and it's a crime that we prosecute. So far in 2025, we've charged 159 drug dealing cases. This is just stuff that our office does every week because those who are dealing drugs in our community are causing public disorder, they're preying upon vulnerable individuals, and they're breaking the law. And that's an area where we just need necessary accountability. Also, you know, there are individuals who are selling fenced items, and we also are prosecuting those crimes and coordinating with City Attorney's Office, and in some cases, the Attorney General's Office to address those behaviors.
Okay, great. Do you have any other diversion strategies that we didn't talk about that you think are effective?
I do want to talk a little bit about drug court. Natalie talked about it, but I will say one of the things that makes drug court so successful is that there are dedicated resources. There are dedicated case managers. There's dedicated housing. There are designated treatment spots and allocations and partners. But also, it's the drug court team. They understand that the cycle to recovery is not a linear path, that it looks different for each individual, and sometimes there is relapse. And allowing for that relapse, but still like coordinating efforts, but being practical about what individual challenges people face is what makes drug court so successful. And sometimes it takes a while to get others caught up to speed and what that recovery path looks like.
Yeah, I'll just validate. If you don't know what that is, Google it. King County Drug Diversion Court. I think that's what the whole criminal justice system should look like. Truly, it's comprehensive, it's holistic. I think sometimes people think there's not accountability. There is profound accountability in that process. There's restitution, there's restorative practice, and I know many, many, many people who are graduates who are successfully raising families now and running businesses, and they're leaders in our community. And they have to live with a lot of remorse and regret and sorrow for the crimes that they have committed, and somehow find a way to reconcile that and to press forward and to try to break the cycle for others. And it is the most inspiring thing going on. And I'm always bemoaning the fact that we restrict that opportunity to a few people. It's about 110 people at a time. We've got a very prescriptive idea of what connotes a drug crime. But a lot of the crimes in our community are associated with drug use, drug dependency. And so I know there's talk right now of community court at the misdemeanor level, and I'm a huge fan of that because I see that as an opportunity to, again, prevent people from getting so far downstream to the felony space.
And so a lot of these programs are voluntary. Leesa, can you talk to us a little bit about Ricky's Law and when that might come into effect?
Sure. So, under Ricky's Law, we have to have the Secure Withdrawal Management and Stabilization Facility opine that a person's recurrent drug use or alcohol use causes a clinically significant impairment, including health problems, disability, or a failure to meet major responsibilities at work, school, or home. A referral can be made and a person can be held for up to 120 hours. And during that time, it can be an important interruption point where we can get someone stabilized enough or detoxed enough to voluntarily enter into treatment. But the 120-hour marker is important because by the end of that 120 hours, a person is entitled to a full trial because their civil liberties are at bay, are at stake. My challenge with our involuntary treatment, both in terms of Ricky's Law and also as it relates to mental health and behavioral health, where someone is a harm to self, others, or gravely disabled, is that in King County it's a very adversarial system because someone's civil liberties are at stake. I take that very seriously, but I have always wondered what would it look like if we could rewrite our state law so that we had a more collaborative process where we had designated crisis responders, prosecutors, public defenders, judges, first responders working together to ensure someone gets help in the least restrictive means possible at the earliest point in time. And to this end, I am leading a statewide Involuntary Treatment Act listening tour. We are going to do this listening tour in 8 counties in our state, and we have completed our listening tour in Whatcom County, and we're in the process of completing our listening tour in the Spokane Valley and surrounding area. And there are some themes emerging as it relates to where there are breakdowns in our system and where there is a lack of coordination. This is a project that I started back in 2023 when I first took office. I spent all of 2023 reminding all of the lawmakers that I talked to in 2022 that I was going to lead this listening session because I know at some point someone's going to tell me that I'm not the subject matter expert, which I will own. But I built a team of individuals, someone from law enforcement, Steve Strand, the executive director of Washington Sheriffs and Police Chiefs, someone from Disability Rights Washington, our public defender, offender from Snohomish County, retired council member Sally Bagshaw, the elected prosecutor in Whatcom County, someone with lived experience who's also a direct service provider from Spokane, and someone from NAMI. And together we're conducting this in collaboration and partnership. And the reason that we're doing this is because we all think that there can be a better model, that we can have a combination of treatment upon demand that works in collaboration and coordination with an involuntary system with lots of places to avoid the involuntary treatment process, but also jump off places so that if someone starts out as involuntary, they have access to voluntary services. This project is going slower than I would like simply because it's unfunded. It's something that my office has invested in, and everyone who comes to the table is coming in addition to their already heavy responsibilities. But we do plan to issue a report, and we do plan to share our findings with lawmakers at the midpoint level.
So from dispatch to prosecution, where do you each feel it's just to intervene, balancing people's civil liberties and our responsibility as a community to ensure these folks are safe as well as the communities around them?
I can share a couple examples from 911. Unfortunately, I would say most days if I'm on the floor, I observe our failure to intervene in a way that saves somebody's life. So often you probably would have seen people muttering in traffic. People appear to be high. We've had folks who think they can fly. And it is interesting because sometimes I'll walk, I always say on the floor, but 911 dispatchers, all the different stations, and I can palpably feel grief or sorrow or frustration. And often I'll go to the supervisor and say, what's going on? What just happened? Because it gets very quiet sometimes. And there was an account recently where for a couple hours on the Ballard Bridge, we were getting all these calls that somebody was wandering in traffic. And it was interesting jurisdictionally, too, because it was kind of in between two precincts. And so we're trying to, and there was a lot going on in the cities. We didn't have a lot of officers available. So eventually a patrol officer goes and intervenes with this man. I don't know if he was under the influence. I don't know if he was having a psychotic break or what was happening, just that a lot of calls had come in. The officer talks to him, calms him down, and moves him back onto the sidewalk and stresses he needs to remain on the sidewalk, and then goes on to another call. All these calls are coming in. My folks were distraught in 911 because they know full well he's not going to stay on that sidewalk. And 2 hours later, he is deceased. His head is split open. And so that is what I'm challenging people. It is not, again, correct to just say, we're going to let him make a choice. He has his autonomy. To me, that would have been an appropriate moment to intervene, to make sure that we are bringing him inside somewhere and having him evaluated. When I talk to patrol officers, I go around and do law enforcement roll calls sometimes, and I'm trying to simplify it and say, yes, I know the law. I understand. Again, that officer did his job. He made sure there was no law was being broken. He did his job. He intervened. At this point, care responders weren't in North Precinct, so I didn't really have another alternative at the time. But I'm always saying, what if it was your brother, though? What if you love the person? Would you leave them there? Would you? And every day I see accounts like that. And so I commend Leesa. I am cheering that we are really evaluating this and trying to be more thoughtful about when and how and to what end do we intervene. And it shouldn't be to punish, but when we can save somebody's life or save the grief, we absolutely should as public servants.
For me, I like to tell this story from 2022 that I think highlights the way that our system can work, that can bring accountability, interrupt behavior, but still put someone on the path to recovery. So we had an individual who completed in the course of 22 days, 27 separate thefts of alcohol from the downtown Target. Clearly, this person had a substance use disorder problem, but he was also scaring employees and workers. When that case was referred to us, and it took a little bit of time because of resource challenges. When the case came into us, it took a while to review it. By the time we filed it, this individual had finally started making contact with his lead case manager. I still authorized the filing of that case directly into drug court. And I got a call from the lead team, and they were upset about that. But while that person was in drug court, they still had access to their lead case manager. That connection was not broken, but they were also now in touch with the dedicated resources of drug court. They had a designated case manager, dedicated housing, dedicated treatment dollars. So while that person was on the upswing, we made the decision to surround them with greater support so that person could get the help that they needed, but they were also removed from the situation, so they were no longer scaring workers at Target.
I would say the point of intervention from my perspective is when you know that that person is potentially a danger to harm themselves first. And then you know that that person could potentially be a danger to harm others or others' property. And so that is the point of intervention. When we talk about how we intervene, that is really key. Is it a soft touch, whatever that means, or is it, wow, we have an opportunity here to intervene and provide all of the resources available to try and address that person's need. And that is something that in the 28 years that I've been involved in this work, we have not always done that well. And so we have an opportunity now with diversification of response, of actually having this forum tonight and this panel and talking about it, is what is actually needed to properly intervene and what's the point of that intervention. And so for the officer that Amy spoke to, we have said, the officer's job is to make sure that the laws are followed. And we've also tried to provide law enforcement with some other tools to be able to connect to other resources. In terms of our care department, we want to be able to build that to be that diversionary response. In terms of prosecution, whether it's at a misdemeanor level with the city, at a state level with the county, or even at the federal level, all of those systems should have built in some sort of therapeutic model. And so that should be the point of intervention. When we have waited for the gentleman that is walking in the middle of the street, we are too late, because there were signs along the way where we could have intervened. And so we are in that process now, and have been for decades, of we are trying to intervene now. When people, they're not too far gone, everybody can recover, everybody can have second and third chances for that. But we have to invest, and we have to also invest in the time and know how many connections and times that it make, but to make that person have a connection point to treatment. But we definitely have to intervene when we see people who are absolutely posing a danger to themselves, to others, and to others' property. We can't look the other way.
That brings us to the conversation about crisis care centers. These offer a continuum of services from voluntary walk-in clinics to involuntary treatment. And a couple of years ago, King County voters voted to pass a levy that would make 5 new centers available across King County. And this is a place that anyone can go for urgent care for a wide range of mental health and substance abuse crises. The first one of these is now operational in Kirkland, and very recently there's been talk about a second potential crisis center site on Broadway near Union here in this neighborhood. And this would be the central site to serve Seattle. And this is at top of mind for our communities, undoubtedly. And we are waiting for more details from the county to learn about how we can communicate around this and share information and have a larger community engagement process. And when that's made available, the First Hill Improvement Association will be sure to share that information out. But tonight, how do you see the addition of crisis centers in this mix, addressing public health and public safety needs?
Well, I'm excited about these. I mean, I need places to take people, right? I've been saying that from the beginning. I can feel in the community. I moved back here in 2022. I was gone the 6 years prior, and I was kind of oblivious, I think, when I lived here before anyway. I can tell that there were sites that were not well managed, that there are a lot of concerns. There's a lot of fear in communities. Every time we open up anything around behavioral health or mental health, people are scared. They think we're going to attract drug dealers, that there's going to be crisis spilling out all over the place. And I think that that's a valid fear based on what has happened in the past. I also have been to sites, Connections is one of them, beautifully managed. I have not heard about any adverse impact to the neighborhood at all. I'm really tracking, again, 911 calls. Are they coming in around these sites? I've shared before that I am primarily in South Lake Union at the West Precinct, and I had walked by many times a co-lead site, the Civic Hotel, which is stabilization, low barrier shelter. No idea. I thought it was a hotel, and I walked by it all the time. It was beautifully managed, even though that was quite a vulnerable, high needs population. So I know that this can be done well, but we need to do it well. We need to be very thoughtful about security. We need to be good neighbors, and I think thoughtful about the population size and the acuity level of patients.
You know, I agree with everything that Amy just shared, and I cannot speak to the King County Executive's process about this because as the chief legal advisor to King County and the executive being my top counsel, I cannot speak for him nor reveal, privileged conversations. But I will assure this audience that we in King County want the same thing as everyone here. We want safety, and we also want people to get the help that they need. I agree with Amy. I'm excited about these facilities because we do need a place to take someone. I did tour the Kirkland facility, and I will tell you it is extremely well managed. It was I would say nondescript in the sense that it is not an outlier in the neighborhood. I, at no time, felt unsafe. It was a calm environment. And I think, honestly, if someone hadn't told me what I was seeing, I would have thought that I was in a group health office, but way less crowded. It was really, really well managed. And I think, right now, we have crisis in this community. But what we don't have to accompany or address the crisis is the care facility. So I think if you want to get rid of the crisis, we have to have places to take people. And I can, like Amy said, I can totally understand why there is fear and concern because people want assurances that that's not going to happen again, that this is going to be a facility that people are managing well, but also being very open and transparent about what is transpiring in terms of treatment and whether there is an impact on the neighborhood and monitoring that very carefully. And also being very open to receive any type of complaint or concern and address that in an appropriate and timely fashion.
I would echo some of the same things that both Amy and Leesa have shared. And I know that the specific location of this next crisis center is at the top of minds, and people have a lot of questions and very strong feelings about it. Setting that aside and wanting to acknowledge it, I think one of the things to think about is when we open up any sort of care facility, wherever it is, we should take into account the type of clients that are there, the neighborhood, and making sure the neighborhood is part of that process. And also understanding what we can do from a crime prevention through design to make sure that vulnerable clients who may be in some of these crisis care facilities, that we've done everything that we can to address the outside environment through design, but also through management of expectations and engaging the community. So I think that's also really important. But ultimately, this is a decision and process for King County, so I'll leave that there.
And while we're waiting for more information about conversation around this topic, I just want to direct you to this email. The county is taking input, so if you have questions or concerns, please email this email and share your thoughts. And then as soon as we have more information about further conversation around this, I'll be sure to loop everybody in. So as we are moving forward together, how do we ensure continuity across the system? So I'm just curious what your philosophy or approach is around this nexus of public health and safety, and how do we ensure that practices and programs maintain ethical consistency across the system?
I'm just glad it's not my email up there. I was looking to check because generally I'm the recipient of all distressed emails in the city. So I think the main thing is just to coordinate. It was really interesting. I've not been around the government. I came into this job and I was trying to figure out who are my collaborators, who's doing what, and I was so confused. I was confused about what the city does versus the county. Housing's in all of these different places. Behavioral health is over here, but then there's mental health, and then there's health, and then there's criminal justice, and so I just sort of ignored all of the walls and territories and silos, and got to know everybody in the space pretty fast, and have been very pleased at how collaborative people are. I do feel like I'm a member of the county, a couple county teams actually. We talk all the time. Community-based organizations and resources are everything to me, right? I need to have strong relationships. We don't need a formal contract to be able to refer to these resources. Anybody who's been trying to help, generally I'm seeking those people out so that we can coordinate. The design isn't good. It's just not. I like the whole framing of tonight talking about public safety and public health as one, because they are. And there is intersectionality. It shouldn't be 6 different teams interacting with one person, right? You should be able to, if you are living unsheltered, and you have all of these different conditions and struggles and challenges and concerns, you should have a person that you can trust who can help you navigate the complexity. And that is not how we've designed. And so these women are 2 champions working to sort of unwind a lot of the complexity and make it simple and person-centric. But I think in the short run, what we control is, again, our willingness to collaborate, to absolutely put aside the territorialism and the ego and who gets credit for what. Just put it down and work together. And again, that part's been really fun because I find that people are very happy to work together and relieved to have a partner.
I echo that. I think that there are lots of really good people working in this space that are willing to be innovative, who are willing to break down silos, who are willing to be practical and focus on solving problems as opposed to fighting over turf or credit. And, I give lots of credit to Natalie and to Amy for being good partners in this work. I am really encouraged by what we're seeing in our community. I think that things are looking better. And when I say that, I always, add to it, that doesn't mean that we're done. It just means that the collaboration that we have been building is having the right impact and things are trending in the right direction. So that is a sign to keep going, not to declare victory. But the collaboration, the willingness to think and act differently, I feel like we are at this really sweet spot, and it feels really good.
I want you to repeat what you said about providers and ethical outcomes. I want to make sure I got that question right.
Sure. How do we ensure practices and programs maintain ethical consistency across the system?
Good question. So I'm going to try to answer that piece of it. I think I echo everything that Amy and Leesa said. I'm really lucky to have them as partners in this work now, and even previously to that. I think, how do we ensure, those ethical outcomes with practices and providers? I think, first of all, to make sure that you understand and name and define what is the outcome you're trying to achieve, both by the practice and the providers. I think that's the first piece. I think the continuum is, we have to think about the continuum in terms of the services and the system that we have, and whether that continuum is actually working together well and right. But the other continuum is who all is working in this space. And I want to say a couple of things. Obviously, Seattle Police Department, Seattle Fire Department, our healthcare workers are key to this. But the other thing about this is our service providers. And I always want to make sure to name our outreach workers and service providers that are really engaged in this work, and our residents, some of which who are compassion fatigued, who have faced a lot of crime and public drug use, that we are also engaged with them and making sure that whatever outcomes that we're trying to achieve, that we are listening to those, to our residents. I also think our community organizers, our community providers who have been in this space, we need to be listening to them and making sure that the fidelity of what we're looking for in terms of our practices and our services match what outcomes that they have also said that how they want their community to be served. This also includes our small and large businesses and our BIAs that are working with our neighborhoods. So I think one thing to think about is the continuum of how all this works together includes everyone, and everyone's voice matters. And we should be listening to the solutions and also the challenges that everyone that plays a part in this system has in order to actually get to, I think, good outcomes.
And these issues are big and complex, no doubt. And understanding all the different peoples and programs and resources and responders can be a lot. But how can we, as members of the community, as neighbors, as business folks, help support efforts to improve your work in public health and safety?
You know, I will say, I think events like this are really helpful, because what it shows our leaders is that we have a community that is engaged, and our community is watching, and our community wants results, and they care with like a big-hearted way. I'm inspired by the fact that the community is paying attention to these issues. I'm also inspired by the service providers that Natalie just spoke of who don't give up. And they keep going, even though they are fatigued, even though that they have sometimes missteps, or even though sometimes they lose members of our community. They are always working. And so those two forces together, where we have like really inspired services and service provision, coupled with the fact that we have a caring community that wants accountability and results from its leaders and its government, I think that's a great combination.
Yeah, I think we all have a role to play. I mean, I'm getting really folksy these days. I feel like in order to turn things around, every single community member needs to take some responsibility for contributing to solutions. We should all be volunteering. We should all be supporting philanthropically organizations that we believe in. We should be checking in on one another. I talk a lot about rebuilding the village, because underneath a lot of this, when people ask, why is there so much anguish? Why these rates of suicidality? Why these rates of addiction, and just despondence that you see correlating with the crime and the crisis? The solution to that really is connection. It is. And so we need to do our part. It is significant when you say hello to someone, especially somebody who feels invisible or left behind. I think generally, even on the street, as I'm walking around just as a civilian, I can tell if somebody is perhaps escalating, right, and could be chaotic or violent, and if somebody's not. And generally, I am talking to anybody that I feel is safe to approach and acknowledging them. And so I encourage you to do that. I love this participation. I encourage you all to vote and vote responsibly. Don't get your information from TikTok. These are really complex issues. And I think that a lot of Seattleites bought into the idea that, oh, this is the problem and this is the solution. Nothing we're talking about is that simple. Nothing. Homelessness is not that simple. SUD is not that simple. Breaking cycles of crime, this is all really complex. But again, the solution is to make sure that we've got a system that will predictably repattern behavior. We shouldn't be paying for things that don't. We shouldn't. Any kind of intervention, whether you're talking about nonprofit diversion intervention or, again, a coercive one, predictably that person should be better off, should be more stable, more happy, and more healthy in a year if we're getting it right. So let's vote for those things.
But I just want to thank you all for coming and thank our panelists for taking time to talk. If you want to stay in the know about what's happening in the neighborhood, please sign up for our newsletter. We're also going to be reconvening a First Hill Improvement Association safety committee. So if you're part of the newsletter, you'll hear word of that, where we'll start convening more often around these issues that are important to us all. So thank you again for coming tonight, and thank you to our panelists.